Let us study about the chapter of dentin today. Let us go on to the development of the tooth to understand dentinogenesis. During the early bell stage, these inner enamel epithelial cells start stimulating the cells of the ectomesenchyme, and they stimulate or have an inductive influence on the cells of the dental papilla. This causes the cells of the dental papilla to organize on the inner aspect of the cap. So, the inner aspect of the enamel organ is where all these cells start getting organized, and these are the ones that start differentiating into odontoblast. So, these odontoblasts differentiate, they multiply, so they divide profusely, and you have a big crowd of odontoblasts getting accumulated just beneath the inner enamel epithelium. The enamel organ shows the presence of a cell-free zone just beneath the inner enamel epithelium. As the odontoblasts start differentiating, this cell-free zone is lost and it starts appearing below these differentiating odontoblasts. So, initially in early bell stage, you saw a cell-free zone below the inner enamel epithelial cells. After the differentiation of the odontoblast, you start seeing this cell-free zone below these odontoblasts. This cell-free zone actually is a space which is provided to these odontoblasts so that they can move towards the pulp as they deposit dentin. So, these odontoblasts, as they differentiate, they become a factory of all these organelles, and now they start producing collagen. This collagen is deposited in close proximity to the dentino-enamel junction, and as these odontoblasts deposit the first layer of predentin, they move pulpwards. Now, once these odontoblasts have laid down the first layer of predentin, they will move pulpwards and they will start mineralizing that first layer of predentin. This is actually the mantle dentin. The first fibers that these odontoblasts deposit are large diameter fibers, and they are called as Von Kropf fibers. These fibers are originated from the odontoblast and are almost perpendicular to the dentino-enamel junction. Once these fibers are deposited, then the actual mineralization of the mantle dentin occurs. This particular odontoblast starts depositing some units called as matrix vesicles. So, these matrix vesicles is actually an environment in itself which has all the properties required for mineralization. So, these matrix vesicles are deposited by the odontoblast in relation to the collagen fibers. And these matrix vesicles, because they have an environment that promotes crystal growth, so crystal is formed and the crystal starts growing by centripetal direction. So, each collagen fiber will have multiple crystals or matrix vesicles in close proximity. Now, these matrix vesicles, they start depositing minerals around the collagen fibers, and then gradually the crystals fuse with each other. So, that is how you have the collagen which has been deposited initially now getting mineralized. So, let us understand what this mineralization pattern is. If I want to summarize the pattern of mineralization, there are two techniques. One is the linear pattern of mineralization and one is the globular pattern of mineralization. The linear pattern of mineralization will always be seen in areas where the mineralization occurs along collagen fibers, like in the mantle dentin area. So, this pattern of mineralization is a very slow, systematic and organized pattern. There are not much defects that can be seen, and that is why the mantle dentin does not show you any type of defects. The other pattern of mineralization is the globular pattern, where globules are formed, and these globules will fuse with each other as they start growing. Here the crystals are about 3 nanometers in thickness and about 100 nanometers long. The globular pattern, the globules of crystals will grow and fuse, and that is why there is a chance that there may be some mineralization defects. Globular pattern of mineralization is usually seen in areas where quick mineralization is required. So, whenever slow sustained mineralization is required, you will have the linear pattern, whereas when you need quick pattern of mineralization, it will be the globular technique. So mantle dentin was the one which was showing you linear pattern of mineralization. Just below the mantle dentin, now there is a sudden urgency to start depositing dentin. The first layer of pre-dentin was deposited in the advanced bell stage. And this first layer of pre-dentin was deposited in a very, very controlled, calm, comfortable environment. Once the pre-dentin is deposited, the pre-ameloblasts get converted into ameloblasts and they quickly start laying down enamel. So now there is a need for the dentin to quickly start producing more dentin. And this is what leads to the formation of interglobular dentin. So the mantle dentin is undisturbed, very calm, composed form of dentin. After that, the odontoblasts suddenly want to deposit quick dentin. So they go in for a globular pattern of dentin. And that is why this globular pattern of dentin is usually seen just below the mantle dentin. Here what happens, the globules are released by the odontoblasts, the globules start growing, and sometimes in some areas these globules are not able to fuse. So the area between those globules remain unmineralized, and that is what is called as interglobular dentin.